Bringing a new life into the world is an incredible experience, filled with joy, love, and learning. As parents, you quickly become experts on your little one, their cries and coos. Understanding their health and well-being is part of the journey. Babies communicate when something isn't right. Their bodies speak volumes. Recognizing early signs and symptoms is crucial. We'll walk through common signs every new parent should know. Remember, this is for educational purposes and not a substitute for professional advice. Always consult with your pediatrician if concerned. Let's talk about feeding, shall we? It's the cornerstone of your baby's growth and development. But it can also be a source of stress for both baby and parents. If you're noticing your little one is having trouble latching on, or their suck seems weak and uncertain, don't ignore it. Maybe they're refusing to feed altogether, or you're dealing with a lot of spitting up, even vomiting. These, my friends, are not just spit-up situations. They could be signs of something more serious. Your baby's feeding habits are a major indicator of their overall health. We all know newborns sleep a lot and cry, sometimes for what feels like no reason at all. But how do you differentiate between a typical sleepy newborn and one that's excessively sleepy, almost lethargic? It's about recognizing a change in their normal patterns. On the flip side, if your usually calm baby becomes inconsolable, their cries taking on a different tone, a sense of urgency, that's another red flag. Trust your instincts. You know your baby best. Any sudden drastic changes in their sleep or cry patterns warrant a call to your pediatrician. Take a moment. Just listen to your baby breathe. It's the sweetest sound, isn't it? But what if that gentle rhythm changes? Rapid breathing, shallow breaths, an irregular pattern. These can be signs of respiratory distress. And then there's the flaring nostrils, the grunting sounds with each breath, even wheezing. And if you notice a bluish tint around their lips or face, that's called cyanosis, and it's a sign that they're not getting enough oxygen. These, my friends, are serious signs. Don't hesitate, seek medical help immediately. Medical. Chapter 4. Temperature check. More than just a feeling. We all know about checking for a fever, right? A temperature above 100.4 degrees Fahrenheit or 38 degrees Celsius is a clear sign that something's up. But did you know that a low temperature can be just as concerning? Hypothermia, a temperature below 97.8 degrees Fahrenheit or 36.5 degrees Celsius, can be just as dangerous, especially in newborns. Their little bodies are still learning to regulate their temperature, so any significant deviation from the norm needs to be checked out. Chapter 5. Skin Deep. More than just baby soft. We love that fresh newborn skin, so soft and perfect. But even baby skin can tell a story. Jaundice, that yellowing of the skin or eyes, is common in newborns but should be monitored. Then there's pale skin, mottled skin, even a bluish tinge, all potential signs that something's amiss. And keep an eye out for rashes or any unusual marks. Remember, your baby's skin is a window into their overall health. Chapter 6. Diaper Duty. The Scoop on Poop. Diaper changes are a big part of life with a newborn. Diapers can tell you a lot about your baby's health. Fewer wet diapers can be a sign of dehydration. Diarrhea or hard stools can indicate a problem. Blood in stool or urine is a red flag. Diapers hold valuable information. Chapter 7. Wiggles and wobbles. Movement matters. Those tiny fingers and toes, those little kicks and stretches, they're not just adorable, they're signs of healthy development. But what if your baby's movements seem off? Floppy or limp limbs, stiffness or rigidity, these can be signs of neurological issues. And seizures, those sudden, uncontrolled jerking movements, are a clear sign that something is seriously wrong. Pay attention to your baby's movements. They're communicating with you in every wiggle and wobble. Trust your gut. Call the doc. Being a new parent is a whirlwind of emotions. But amidst all the chaos, remember this. You are your baby's best advocate. You know them better than anyone else. If you notice any of the signs or symptoms we've discussed, or if something just doesn't feel right, trust your gut and reach out to your pediatrician. It's always better to err on the side of caution when it comes to your little one's health. Remember, you're not alone on this journey. There's a whole community of parents and medical professionals ready to support you every step of the way.